We already knew the new UK COVID variant was more transmissible than the original, but today Boris Johnson announced there is reason to believe it's also more lethal. How worried should we be? I'll in a moment ask Dr. Deepti Gurdasani, a clinical epidemiologist at Queen Mary University. Also on the show, we had good news this morning when it was briefed the Department for Health were finally proposing the kind of policy to support people to self-isolate that we should have had from the beginning of this pandemic and could offer us a way out. Unfortunately, we also have some bad news because the Prime Minister squashed the story by midday. He seems to have ruled it out. We'll be asking, as we often do on this show, why the Tories just refuse to implement that one policy that would offer us a way out of the disastrous situation we are in. And talking about disastrous situations, Dalia, Gebrial, you'll be joining me for the whole show, which isn't the disastrous situation. The disastrous situation is that we are in week 3 of lockdown free. And I want to know how you're holding it together.
I mean, that assumes that I am. Which I don't know. I feel I've said this before. This one is like really hitting me hard, even though it's the one that should feel the most hopeful because at least we have a vaccine on the horizon. You know, my parents are they've both nearly had their first dose, which is like really good. And yet somehow it feels more hopeless than ever. And, you know, I think we're all feeling quite fatigued by it, and especially by the kind of constant failure that the government is enforcing on us. But still really nice to see you all on Friday, as it always is. So I'm excited for a good show.
Yeah, we've got a great show ahead for you. Apart from what I've already announced, we have a very awkward interview with Gavin Williamson. This is definitely, it's a screamer. It's cringeworthy, but you'll probably enjoy it because it is, it's really serving him right for how poorly he has dealt with this pandemic throughout. We also have a shocking story about LBC. Make sure you stay tuned for that. As ever, share the show link. We want to get more people watching live. Tweet on the hashtag #TyskySour with your thoughts, your comments, your questions. Keep your super chats coming, or comment on the Twitch channel. Let's start by taking a look at Boris Johnson giving the bad news.
Since the beginning of this pandemic, we've tried to update you as soon as possible about changes in the scientific data or the analysis. And so I must tell you this afternoon that we've been informed today that in addition to spreading more quickly, it also now appears that there is some evidence that the new variant, the variant that was first identified in London and the southeast, may be associated with a higher degree of mortality. And I'm going to ask Patrick in a minute to say a bit more about that, because it's largely the impact of this new variant that means the NHS is under such intense pressure.
I'm going to show you, the Chief Scientific Officer giving a bit more information. I'm going to talk to Deepti about whether or not or how much more deadly this new variant might be. I just want to point out now, what did Boris Johnson say there in that last sentence? This new variant, this is the reason why hospitals are more full. This is the reason why hospitals are full this time around. Now, we're often suspicious on this show that Boris Johnson very cynically uses the science. It's sort of like, oh, the reason the virus got out of control was the new variant. It wasn't the fact that we went into lockdown late. It was that it was more transmissible. Now, as deaths get to over 1,000 every day, up to 1,600 this week, up to 1,800 actually, in a 24-hour period. Now he's saying, well, actually, the reason that's happened completely out of my control, the new variant is more deadly. And this isn't me being, I'm willing to look at the science. It seems like potentially it is more deadly, but that is such a cynical use of the limited information that is currently available that it's difficult to feel confident in what's going on at the top of government. Anyway, let's take a look at someone who's less cynical. How much more cynical you can decide for yourself. This is Patrick Vallance with more on the variant.
But I do want to say a word about severity and mortality. When we look at data from hospitals, so patients who are in hospital with the virus, the outcomes for those with the original virus or the new variant look the same. So there's no real evidence of an increase in mortality for those in hospital. However, when data are looked at in terms of those who've been tested positive, so anyone who's tested positive, there is evidence that there's an increased risk for those who have the new variant compared to the old virus. Now, that evidence is not yet strong. It's a series of different bits of information that come together to support that. And I want to put it into context as to what it might mean, but stressing that these data are currently uncertain and we don't have a very good estimate of the precise nature or indeed whether it is overall increased, but it looks like it is. And I want to give some context. If you took somebody in their 60s, a man in the 60s, the average risk is that for 1,000 people who got infected, roughly 10 would be expected to unfortunately die with the virus. With the new variant, for 1,000 people infected, roughly 13 or 14 people might be expected to die. So that's the sort of change for that sort of age group, an increase from 10 to 13 or 14 out of 1,000. And you will see that across the different age groups as well, a similar sort of relative increase in the risk.
So you can see that very different tone there taken between Boris Johnson and Patrick Vallance. Patrick Vallance is saying, look, the evidence isn't that clear. The balance of probability with what's in front of us means we think it is a bit more deadly than the previous one, but it's marginal, whereas before it would be 10 out of 1,000, now it's 13 out of 1,000 in the age group he was talking about, people in the 50s, whereas Boris Johnson is like, this new deadly variant is around. This is the reason the hospitals are full. So, as I say, I don't think Patrick Vallance is quite as cynical as Boris Johnson. To talk about the science, because as you know, I'm completely out of my depth when it comes to the, how deadly a new variant is. I'm delighted to be joined by Dr. Deepti Gurdasani. Dr. Deepti Gurdasani, welcome to the show. Thank you for joining us again.
Thanks for having me.
As I say, this is a situation I haven't read the papers. I don't know where we stand with this new strain. What do you make of this claim that they've made that the balance of evidence suggests the new variant of coronavirus, which we've had in this country since September, in fact, is more deadly than the original?
Yeah, so it seems to be based on sort of looking at data among people who were infected and comparing those who had a particular test that could tell us whether this variant was present or not, and comparing the death rates among those. And it seems when you compare people who are matched, let's say for age, gender, deprivation status, and the region they come from, it looks like people with the variant were more likely to die by about 1.3 times, so about 30% compared to those who weren't. Of course, there's a lot of uncertainty around these estimates. And, I think the big question is, are the people who are getting infected with the variant in some other respect different that puts them at higher risk of death? And that's what we don't know. For example, are they more likely to be in institutional settings or care homes, in which case they may be more frail, and that might be the cause of death. So I think what's difficult to disentangle here is the cause of death higher risk of death, the variant itself, or is it something associated with who gets infected with this variant? And I think that's not clear at the moment.
And in terms of the nature of this announcement, I want to get your view as someone with a scientific background, because from my perspective, it does seem like this new variant was more transmissible. When they said that, it wasn't a lie. But there is also a bit of a pattern where if they get sort of preliminary data which suggests something is the case, which is helpful both to their policy goals and more importantly their political objectives, it gets a press conference immediately. So you can think of the new transmissible variant, which means that the third wave we were seeing wasn't the government's fault. This new variant is now more deadly. Very preliminary data, but it gets a press conference because Boris Johnson gets to say this is why the hospitals are full and this is why so many people are dying. You compare that to something like aerosol transmission, which currently has incredibly solid data behind it, absolute scientific consensus that aerosol transmission is a really important sort of vector by which this virus travels. That wasn't politically advantageous to the Tories because they'd been encouraging people to eat out, to help out, and schools all open and everyone go back into shops as long as you wash your hands. And so, that information is basically suppressed. What do you think about the politicization of sort of scientific information that's been going on in this pandemic?
I'm honestly very, very frustrated about it. There's overwhelming evidence about many aspects, as you say, for example, that schools contribute to transmission, but we've been told for months that schools are safe. And when the government finally had to close schools, because obviously they were contributing to transmission, now they're talking about opening them again without any safety measures in place. And the idea that it's the emergence of this variant that's the only thing that's led us here is frankly just not true. I mean, there are countries like Australia and New Zealand and much of Southeast Asia who don't even have to contend with new variants because they eliminate it, they contain transmission. We have new variants like Manaus and South Africa, and potentially many other countries do, because we let transmission run wild for a really long period of time. Not only that, we now also have the South African, or the variant that originated in South Africa within the UK, despite being warned about this early on, and we could have prevented it coming in, contained it like countries like Australia and New Zealand did, but we didn't do any of that. So the idea that it's just the change in the virus that has led to this is frankly completely not true. Where we are is entirely predictable. The level of deaths and the level of hospitalizations, the government was warned about in December, and they were warned about even when they started easing the last lockdown, that this would be the result. And of course, socializing over Christmas, there were so many mistakes made, no mitigatory measures in schools. So where we are was entirely predicted. I mean, I said last month that we were likely to see between 15 to 20,000 preventable deaths this month. And that's exactly where we are right now.
And we're going to talk in a moment about the South Africa strain and the different strains and what they could all mean. I want to focus first on other new information we might know about this new strain, or potentially information that means we should reassess what we first thought, because as everyone admits, this is all very preliminary data. We're sort of learning as we go. And this sort of came to my attention because of a tweet from the ONS, and this concerns. Actually, let's get this tweet up. So they say, in the week ending 16th of January, this is from today, the percentage of positive cases that are compatible with the new variant of the virus has decreased in London, the southeast, and the east of England. And then it comes with an image. This is, these ONS graphs you'll be used to seeing. And in the dark blue, you've got the new variant compatible versions of coronavirus, which are going down in London, east of England, and the southeast quite dramatically in London, and the orange line, which is other positives, less dramatically. And the other, so that's, I mean, to me, suggesting potentially, as not an epidemiologist, maybe it's not as transmissible as we initially thought. The other reason you might think it's not as transmissible as we initially thought is because, if you watched our shows before Christmas, you'll remember we said, if this is 70% more transmissible, then that means that even a March-style lockdown could not get R below 1. We have a lockdown which most people seem to judge is less strict than March, and R has gone below 1. So we are seeing the pandemic shrinking, even if very slowly. So Deepti, as someone who understands this way more than I do, is it time to reassess sort of our initial assumptions about this new variant? Is it, obviously it's a little bit more transmissible than the original virus, but is it to the same extent that we initially thought it was?
I think there's a lot of evidence coming out between ranges of 30 to 60%. And that's what most people think. We don't know exactly how much more transmissible it is, but it's probably around 40 to 50% more transmissible. The data that you showed from the ONS actually shows that in regions where the variant is dominant, it appears to be declining during lockdown. But if you look at the data from Wales, Northern Ireland, and Scotland, it's actually, this variant is still becoming more dominant and steeply increasing. And it looks like in Northern Ireland, for example, it's very recently become the more dominant variant even during lockdown. So it seems to be something about where the variant is more dominant. And I think there could be different explanations for this. One, there's a lot of uncertainty about the data, so it's hard to be sure about these trends. But two, we know recently that there's been the South African variant in different parts of the UK as well. And it's possible that in places where this variant is dominant, it's now competing with potentially other variants that we haven't really picked up yet, because they wouldn't be picked up by the same tests. So I think that's something else to keep in mind. But I do think the variant is more transmissible, but the extent, there's a wide range and it's really hard to know, but it would probably be between 40 to 50%.
And let's talk about the other variants now. I mean, we're hearing about a South African variant, a Brazilian variant. I struggle to keep track of which one's more transmissible, which one's more deadly, which one is potentially more resistant to the vaccine. I mean, what should we be most worried about, essentially?
I think sadly we need to worry about all of them, because they all have different and concerning properties, and they all share some mutations. So for example, the South African variant, the current data suggests that it is likely more transmissible and is linked to the surge of cases in South Africa, but there's also worrying evidence about a mutation that it has, which is shared with the variant from Manaus in Brazil. which shows that neutralization with antibodies to the previous virus strain is much, much lower. So, for example, 50% of people escape neutralization by antibodies to the previous virus, and about 90% of people have a much lower response. What this means in terms of vaccine effectiveness is not clear, because we know that antibodies aren't the only thing that confer immunity. Also, if you have very high levels of antibody, even if neutralization is lower, you can still kind of get over it. So it kind of depends a lot on our response to the vaccines. But, it is concerning. And this news today makes it very clear that we can't gamble with these variants. We can't just think, okay, it's fine if we let them spread, we'll deal with them later. The idea is to essentially prevent them, first of all, evolving, and if they are external to the UK, prevent them actually coming in. And it looks like we haven't done either of those successfully. And now we're in a very, very concerning situation. I mean, I was particularly struck by the briefing today where Chris Whitty said that, it's inevitable that these variants go into different countries. And he, for example, used the example of the variant within the UK, which has now spread to many other countries. But the fact is, it's not inevitable. Australia initially had a case of the variant within, but they dealt with it very aggressively and used very strict quarantine policies to keep it out. And we could have done the same, but we haven't. And now we have to deal with the consequences of not one, but two variants, at least, that are circulating within the UK.
On that note, I want to bring up one image actually that I saw today, tweeted by the former British ambassador to Turkey, France, and USA, although I don't think he was on official business when he tweeted this. This is an image from Heathrow Airport. He says it's Terminal 2, Heathrow, Friday afternoon, no ventilation, long delays, super spreading. Looks like a super spreader event. And that's very worrying when we have, it seemed like the government had actually had a bit of a change of heart when it came to travel. Originally, they were saying, look, there's no point in trying to stop this virus moving across borders. Now we're actually getting briefings. There was one very interesting in The Spectator from James Forsyth, who is a political editor of that magazine, also married to the Prime Minister's spokesperson, so presumably in the know, who was suggesting the government might now go down a bit of an Australia route when it comes to keeping certain viruses out. I mean, you could maybe they're being, utilitarian and trying to stop viruses getting out as well as in. I doubt it, but they're definitely not getting strict on this already. We're going to go on to policies in a moment in terms of £500 cash grants and fines for parties. First of all, there's just one question in the super chats that I want to put to you, Deepti. It's from Carl of Martin with a £5. Thanks, NM. Could I ask Deepti if our 12-week vaccine strategy may facilitate escape mutation? So because of the low efficacy from one dose over more time. What's your take on that, Deepti? Seems to be quite a lot of actually, scientific disagreement here as to whether or not having a longer gap between the first and second vaccine is too much of a risk.
Yeah, I think that's a very difficult question to answer because there's disagreement even among scientists, and I'm not a vaccinologist or an immunologist. I think the concern is that if the immunity levels are lower after the first dose, they could potentially facilitate escape of the virus because they don't provide, sterilizing immunity against the virus. I mean, I think the concerns are legitimate. Also, given early data from the vaccine showed that neutralization may not be very good, even in the elderly, particularly after the first dose, and tends to decline over time. And the booster dose is really, really essential for giving that boost to the immunity and for a longer-term response. So, I'm slightly nervous about the policy in terms of what it means for escape variants. I'm not certain, but with a variant that's circulating now from South Africa, which we don't know what that means in terms of vaccine effectiveness, that makes me even more nervous about having, I guess, a partially vaccinated population rather than a fully vaccinated one, because particularly with variants against that, when we're not sure about the effectiveness of the vaccine, we really want to try our best to ensure that people are immunized fully. Having said that, I know that we're in a crisis and we need to vaccinate as many people as fast as possible. But I guess that's the thing. We're having to make these really difficult decisions that cause uncertainty because we're in a crisis and we didn't have to be here. Countries like Australia, South Korea are not having to debate and consider deviating from protocol, which obviously leads to uncertainty. But it's hard to know what the right balance here is. But I do hope that if the government have taken this route, they will put in place measures, particularly trials, to actually assess what's going on so that we can mitigate this uncertainty and respond very quickly if we find people are not developing the level of immunity that we anticipated.
Or we'll have the scientists work out that something problematic is going on, and then Boris Johnson will sit on his hands for a couple of months, as has been sort of usual throughout this pandemic. We're going to go on to some, capital P policy questions now, because we have had some more briefings in the past 24 hours about policy responses to COVID-19. So last night, The Guardian got hold of a leaked policy document from the Department for Health, and that was proposing the government offer a £500 cash grant for anyone who tests positive for COVID-19. Now, that's in a bid to encourage people to get tested and then to self-isolate. The assessment being that one of the reasons people aren't getting tested is because they can't afford to self-isolate, so they don't want to know if they've got coronavirus. The paper also suggests scrapping any support for contacts of those who test positive, instead offering them regular lateral flow tests. I'll definitely ask Deepti about that in a moment. And the sharing of health data with police to help them crack down on people breaking self-isolation rules. Now, we'll discuss all of these proposals in one moment. First of all, here's Environment Secretary George Eustace fielding questions about the plans or the suggestions this morning.
We're obviously in a full lockdown at the moment, so everybody should be staying at home wherever they can, unless they have to go out to work. We do know, we've always recognised that if you ask people to self-isolate because through contact tracing they've been in contact with someone who's had the virus, that is a financial challenge for some. That's why we've always had a £500 payment for those who qualify for certain benefits. I'm not going to comment on this particular paper, but we've always kept it under review. We do need people, if they're asked to self-isolate because they've been contacted through test and trace, we do need them to self-isolate, and obviously we always review the reasons why they might not.
So we'll go into the policy in one moment. First of all, it is always worth pointing out when a Tory politician is on television lying. So he's saying we've always had a £500 grant to support people to self-isolate. Now, that's not strictly true because it didn't get brought in until late September. We might have thought they could have thought about supporting people to self-isolate earlier than that. But the bigger issue is this £500 that he's touting there as the existing policy, which is supporting people to self-isolate. It doesn't work. It is not working. So there was some really important data, actually, which was obtained by the Labour Party. Well done to them for this. Shared with Newsnight, and it shows that between October and December last year, there were 49,877 claims for this self-isolation grant, and only 12,000 were successful. So 35,000 were rejected. So that's to say, if you want to self-isolate, you say, look, I'm on a low income, I need support if I am to self-isolate. 2/3 of the time, the government or your local authority, because they're following government guidelines, will have to say, no, sorry. So you either have to make the decision, I'm going to skip meals and stay at home, or I'm going to go out to work, even though I know the right thing to do is stay at home. We've done sections on this before, really, really appalling. Although I hadn't quite grasped how poor the numbers were, because I went and looked up, seeing that figure, 12,000, is it really only 12,000 people who've successfully received this £500 grant between October and December? Because I looked this up, and between October and December, 1.7 million people tested positive for COVID-19. So if you had 1.7 million people testing positive for COVID-19, and now the BBC are telling us that only 12,000 people got the £500 grant in that period of time, that's not very impressive, is it? That's not going to do much in terms of pandemic control, which might be why the government's own polling has found that only 17% of people with COVID symptoms are coming forward to get a test. That's, again, owing to fears that a positive result could stop them from working. I'm going to go straight actually onto, Deepti, I want to know your perspective on this before sort of like we tell the story of what happened to these proposals, what Boris Johnson has now said about them. Do you think this £500 once you test positive is a good idea?
So, the government policy on this has been absolutely shambolic. It's very clear that although they've invested billions into testing and tracing and Operation Moonshot, all of which has not achieved what it was supposed to, they've actually done nothing to support people with the end result of that, which is isolating. The UK has the lowest support for COVID across the OECD. Countries like Germany, Austria, and Iceland actually provide full income support. And compared to that, we are providing people with almost nothing. And as you say, even what's supposed to be available isn't accessible to many people. So in terms of making things more accessible, I definitely support a move towards that. But I really don't feel it goes far enough. I mean, we're still paying people only £500 for isolating for 10 days. For many people, that's going to be a huge pay cut. And many people with families are not going to be able to afford that. And that's a basic issue that isn't being dealt with. It also doesn't particularly support the people who need it the most. I mean, not everybody necessarily will need that £500. If they're going to spend so much money on it, it makes sense to really target it to the people who really need it the most, but give them full income support rather than them having to choose between, paying their mortgage, feeding their families, paying the bills, and isolating, which they shouldn't have to do.
Yeah. No, that's interesting. The argument that it should be targeted but higher. I want to focus on this £500 and what the government's or the whole government's approach seems to be towards it. Because whilst it might not be perfect, it's much better than what we've already got. It's actually, from my perspective, one of the most forward-thinking suggestions we've had when it comes to supporting people to self-isolate. Because whilst there are arguments that it should be targeted, I think they're very legitimate. The argument as to why everyone should get it is because that cuts out a layer of bureaucracy. People don't have to wait for it. They get their result, which is positive, and then the government transfers them £500 via universal credit or whatever mechanism they decide to do it. Unfortunately, this policy seems to not be going anywhere. So let's look at the first sort of round of attacks against this policy. It was from the right-wing newspapers. So this was the Daily Mail this morning. £500 COVID cash point. Minister's astonishing plan to give everyone testing positive a one-off payment at a cost of £453 million a week. How could we spend so much money per week? That's almost as much as we give to Serco every week to fail to trace people. The Times, that's a higher brow newspaper, £500 for catching COVID under plan to slow the virus. So they sort of framed it as this idea, you get £500 for catching COVID. And what we've seen sort of even on the BBC today, is lots of people asking, oh, well, if you give people money when they catch COVID, maybe people are going to go out and lit lampposts because they're so desperate for £500 that they're going to risk a very dangerous disease, which they're seeing people die of every day on the TV. It's really, to my mind, going back to the language of welfare scroungers, where you can't give people financial support because that will mess up their incentives, and then they'll do, ridiculous things just to get that fairly pitiful amount of money. Dalia, I want to bring you in on this because sort of the thought that I had when I saw Boris Johnson kill this dead. So he's basically, since briefed, Downing Street have said this isn't happening. We don't like this policy. We don't know who leaked it in the Department of Health. And even if it is the preferred option of the Department of Health, we're not doing it. And what that made me think, and Rishi Sunak said it's too expensive, is that I think the real opposition to this from the government is not that it's a lot of money, it's that it goes straight into the pockets of ordinary people. So if this was something that you could channel via Serco, if it was something you could channel via Deloitte, the government would have zero problem whatsoever with spending £453 million a week. But because this just goes directly in people's pockets, they have no interest. I mean, I almost feel like from a public health perspective, we should just say, look, Boris Johnson, because we're so desperate for this policy, if you just want to randomly give a 20% cut to Deloitte, do it, because we desperately need money to self-isolate. And if the only way to motivate you to do that is corruption and cronyism, fine, we'll take the hit. I mean, what's your take? What do you see going on here?
I mean, this is because it is the job of the Conservative Party to redistribute wealth from, everyone to the already wealthy few, rather than, to the many, even though that would be a much more logical and rational use of those resources. But, I mean, clearly something is really wrong. As you mentioned, I mean, I was stunned by that statistic that only 17% of people with symptoms are getting tested because they're worried that they'll have to miss work if they test positive. And, this is the data that has supported what we've already known and what we'd already said, which is that being able to isolate without any additional financial support is a massive privilege that is not available to most people. And we saw that last week with, the number of people getting on the tube at 8 a.m. In the morning. So this is a reality which, we've known throughout the pandemic. This data only kind of supports that. And now in this lockdown, that category of key worker has been expanded so greatly. ensuring that basically fewer and fewer people are eligible for the furlough scheme, employers are now incentivized to categorize their workers as key workers, even if they are not key workers, and making them go to work would unnecessarily put them and their families and the broader community at risk. And there's no recourse for workers to challenge that. There's no means through which a worker can say, look, I'm being made to work, even though it doesn't make any sense. I mentioned it last week, the example of, people being made to go in and work on beauty counters and Boots. There should be a recourse to be like, why am I doing this? This is absolute insanity. There's no recourse for workers to do that. And if their unions actually fight for them, they are relentlessly demonized in the press. And this takes me to the really disappointing and the destructive coverage by the media of this, which is why I think that Boris Johnson was so quick to squash it. And why it was scrapped before it was ever became a possibility. And they're acting like the support scheme is going to incentivize. I mean, I can barely follow the line of logic because it's so ridiculous, but that the support scheme is going to incentivize people to catch coronavirus. But we haven't heard anything over the past several months about how the existing structure and the existing policy of expanding the category of key workers, of restricting the furlough scheme, incentivizes people to spread the virus. By giving employers free rein over these very important decisions, which they are obviously incentivized to not follow public health guidance and instead follow the profit logic. The existing policy is literally incentivizing people to not do the thing that is actually going to keep them and their community safe. And it's instead incentivizing them to actually spread the virus because of the existing policy. But we didn't see any headlines about that in the press, only when the government actually, there's a hint of an idea that, as you said, wealth might be redistributed to everyone in the way that makes the most sense rather than funneled through the already wealthy few. That's when we hear the outcry and the very irresponsible coverage.
Absolutely. And I mean, what the government and the media seem to both sort of collude to portray as the key problem with the pandemic is, do we need to be tougher on people? Do we need to be tougher on people going to parties? Obviously, don't go to parties during this lockdown. Do we need to be tougher on people going for walks with their friends in parks? I think you can go for a walk with one friend in a park, actually. And, there's sort of like a collusion really between the political editors of the country and the politicians of the country. At Boris Johnson's Downing Street press conference today, no one asked about this self-isolation policy being squashed by the Prime Minister. No one asked about that 17% figure, which is from the government. I gave you one figure, which was from Labour research. The 17% of people, only 17% of people go to get tested because they're worried about the financial consequences of testing positive. That's from the government. And no one at the Downing Street press conference asked a question about it. Obviously, what they want us to talk about is people breaking rules. They want us to blame our neighbours and our friends, or many people we don't know is who they're trying to get us to blame. Anyway, this is Priti Patel on that topic at her Downing Street press conference yesterday.
If you don't follow these rules, then the police will enforce them. Police officers are now moving more quickly to handing out fines when they encounter breaches, and they have my absolute backing in doing so. As we have done throughout this pandemic, we are constantly reviewing our approach to ensure that we can crack down on those most serious cases of rule breaking. And today I can announce that next week we will be introducing a new £800 fine for those attending house parties, which will double for each repeat offence to a maximum level of £6,400.
So that's £800 for attending a house party, which will keep doubling every time you do it until you get to £6,400. I assume not many. You'd have to be super rich to do it more than once. This replaces the existing policy, which is you can get fined £10,000 for hosting a party. So these are sort of the stick policies to try and make the lockdown stronger. We should also add to this actually that in that sort of Department for Health policy document was a suggestion that health data, again, this isn't yet government policy, that was a suggestion by the Department of Health that the police could be briefed about health data so they can better enforce the lockdown. Deepti, I want to bring you in on this from the perspective of an epidemiologist. How important do you think the kind of announcements Priti Patel is making there are? Is this just a distraction, or does she have a point?
I think it's really concerning because, there's evidence to suggest that overwhelmingly people understand and comply with restrictions. In fact, polls kind of show that people wanted lockdowns even earlier than they were put in. And it's really concerning, this rhetoric about fining people for lack of compliance. It looks like the government puts in place policies that actually lead people to being infected, then puts in policies that don't support them with what they're supposed to do, and then penalizes them for not being able to do that. Like, for example, the fines associated with not isolating. And what that really leads to is people being worried about coming forward for getting tested, for example, because then they have to, they'll be penalized if they don't comply. What the government hasn't done in terms of increasing compliance is good, consistent public messaging, which we know works in the midst of a pandemic. And many countries have done this successfully. Rather, the government has put in place rules that people have followed that have led to increase in transmission, like eat out to help out. And of course, the repeated rhetoric about, things getting over by Christmas, things getting over by Easter, things being over by summer, which has sort of really minimized the risk posed by COVID. So if you really minimize the risks posed by COVID, if you're skeptic about mask use, if you say schools are safe, why would you expect people to necessarily follow the rules? But having said that, people are overwhelmingly follow the rules, which I'm frankly shocked to see, given their really poor messaging. But rather than focusing on improving compliance through support and better messaging, they focused on penalizing people, which is really worrying from my point of view, even from an ethical and moral perspective.
Finally, there was something I mentioned in the, my introduction to that Department for Health policy document, which was they were suggesting, and this to me seems like something the government are more likely to jump on because it would help the economy. They're saying we could replace people having to self-isolate if they were a contact of someone positive with them taking regular lateral flow tests. So we know lateral flow tests aren't amazingly sensitive. You get quite a lot of false negatives. But if you were to take one every day for 5 days, for example, then maybe that is a sensible policy. What do you make of that?
That's not a sensible policy, and it's not in line with the CDC guidelines. And in fact, the MHRA, which is the regulatory agency for medical devices, has also rejected it because lateral flow tests are fine for detecting new cases. So if you were testing people who wouldn't have been tested otherwise, and you find new cases in them, you identify new cases that then you can isolate. So you break those transmission chains. These are people who are contacts of people who've tested positive. So they're people who are very high risk. And you're essentially using these inaccurate tests as a replacement for isolation, which would have definitely dealt with transmission. And that actually increases the risk. And actually, there's good documentation, even from SAGE and from the advice from the MHRA, that suggests that these are the sort of things that increase risk of transmission rather than reduce it. Unfortunately, all of this is in response to low compliance with isolation, and rather than deal with the underlying issues that have led to this low compliance, which is obviously lack of financial and practical support for people, the government has chosen another strategy that is not based in any evidence, which would potentially increase the risk of transmission. So none of this makes sense from a scientific perspective.
Deepti Gurdasani, thank you so much for joining us this evening. You, to me at least, you always make a lot of sense from a scientific perspective. So thank you for making all of these very complex ideas sort of comprehensible to a non-scientist like me.
Thanks for having me.
Let's go to a couple of super chats. So Shalendra Singh with £10. Not locking down early enough, but relaxing restrictions too early made the emergence of deadlier variants more and not less likely. Another Tory fiasco. Absolutely. If you look at something I feel is almost under-discussed, if you look at the direction of travel when it comes to new infections and hospitalizations, there's a big dip. It levels off. Things are going okay in November. And then, for no particular reason, with cases super high, going into the winter months, the government decide now's the time to loosen the lockdown. So unlike March, this new surge was not only, it wasn't that the government just reacted too slowly to it. It's that they actively, for some bizarre reason, decided to create it. Jack Williams with a £5. Why don't the left talk more about borders? I haven't heard one left MP talk about it. They should get on the front foot on this issue. I'm not sure if that's true. I feel like there are lots of MPs, people like Richard Bergen, who are putting forward the idea of a zero COVID strategy, which I think everyone understands is going to have to mean fairly closed borders for at least a year or so. Maybe they could have been louder about it. Callum Pollock, I really like Dalia's artwork. I'm assuming it's a Pollock. You're both legends. Cheers. Is it a Pollock?
I don't know. It just looks cute, huh? Thank you.
maybe you learned something about your picture today. Dalia, we're going to be coming back to Gavin Williamson's, whoopsie on ITV and shocking story about LBC. First of all, this pandemic has been hard for all of us, but it's been particularly difficult for frontline workers, from doctors and nurses to supermarket staff and bus drivers. People with frontline jobs have had to put themselves at more risk from COVID than the rest of the population. For some, for example, teachers, they've also had to withstand gaslighting from a government who refuse to recognise the risks they are taking. Now, one group of workers helping with the pandemic response and whose role has been under-discussed are firefighters. So throughout the pandemic, firefighters have been assisting with roles, including delivering meals, driving ambulances and transporting bodies. However, after a dispute over health and safety between the fire brigades unions, the FBU, local councils and fire chiefs, the FBU have advised their members to stop volunteering to take part in the UK-wide pandemic response. I'm joined now by Matt Wrack, who's General Secretary of the FBU. Welcome to the show.
Hi, Michael.
So on this topic today, because there was a report released by the Inspectorate of the Fire Services, the FBU are taking a battering. So the press have been all over this, and the Tory Fire Minister this morning said, and I quote, "Brave firefighters have been prevented from stepping up to support the pandemic response because of the actions of the Fire Brigades Union." Can you explain to me and my audience what's going on here?
Well, first thing I would advise people to do is disregard everything you've read today in the press. It's completely untrue. It's complete spin. It's almost Orwellian rewriting of what's happened over the past 10, 11 months. We haven't advised people not to volunteer for anything. It's quite the reverse. Back in March, in February, we began to discuss how does the fire service react to the pandemic. And in March, we reached a series of agreements with our employers and with fire chiefs. So if you think about it, the first task was how do you deliver the core service in the face of the pandemic? So as you say, our members, some of them, those office-based ones, have been told to work from home, but most of our members are working in fire stations or in emergency fire controls. And if you think about it, for example, you can't socially distance on a fire engine. There are either 4 or 5 firefighters on a fire engine. You can't socially distance in there. So there are increased risks. They may have all sorts of circumstances in relation to where they live, their family and so on. So we've tried to keep account of that. So we reduced outside activities that were not absolutely essential. So training was reduced, inspections, visits, school visits that we would do, all of those were significantly reduced. And we introduced measures in the workplace. And actually, we've had some very significant outbreaks, but we have had very low levels of absence, and we've kept the workplace pretty safe. So that was task one. We then discussed what else can we do? And we reached an agreement whereby firefighters undertook those additional roles, and we have supported that throughout. In fact, we've encouraged it. We've engaged with the debate with our members and thousands of FBU members. When the minister says firefighters, what he means is these are all Fire Brigade Union members who have undertaken this additional work. So, and think about the one that you said, specialist teams going out moving the bodies of the deceased is quite an alarming task to be asked to do. And they've done all that, but built into it, and to give people the confidence, we have built safety into that from the start. So a risk assessment. What is the activity? Are there particular training needs? Are there particular PPE needs? And so on. And that operated for months, completely safety with, as I say, thousands of our members volunteering. And it's interesting to listen to your previous discussion, because some of this began to break down around the question of testing, because in 9 of those activities, which we deemed to be high risk, people were going from a fire service workplace into another workplace for a period of time where they may be at higher risk of contracting the virus. So it was agreed that there was a hazard of what would happen between that worker going from the one place returning into the other workplace, and all parties agreed that that was a hazard. And risk assessment requires that if you have a hazard, you have to identify a control mechanism for that hazard. And it was agreed that the control measure in that case would be a test, a PCR test. And the requirements for a PCR test is that you take it between 3 and 5 days. So if you look at the advice to travellers now coming into the country, they are required 5 days. Firefighters were advised to do this after 3 days. And in the 3 days, they were advised to, or required to remove themselves from the workplace. It didn't mean they couldn't do some work. They may be given work at home, but they couldn't go into the workplace. A completely safety-based approach. And we began to get employers or chief officers saying, well, this isn't sustainable. I can't afford to be keeping that person out of that workplace. But mainly because of staffing issues, i.e. because of shortage of staff. They identified this as a problem. And interestingly, their words that they've used more recently in an official circular is that it is not sustainable. Well, that's not a risk-based approach. It's about sustainability, which is about staff availability, staff numbers, and the fact that they've cut 11,000 jobs in the past 10 years. They then withdrew that, and they withdrew that safety measure. And that's the point on which a disagreement arose. We could not sign up to they are trying to replace that with lateral flow tests. And as I think your previous speaker knows, that there is a big debate about lateral flow tests, and they're appropriate, where they are appropriate to use and where they're not appropriate to use. And the advice from MHRA is that they can be used as a red light system, i.e. in a closed group, you might identify people who wouldn't be otherwise be identified. What they can't be used as is a green light system to say, yes, you are safe. You can therefore return to the workplace. So there was a decision, not by us, to downgrade that safety measure. And that's when the whole thing fell apart. And on the back of that, I mean, some interesting coincidences here. Magically, Her Majesty's Inspectorate produced a report which they published, as you've seen, and without even discussing with us the latest fallout, they have reached conclusions that this is all the union's fault, and it's outdated industrial relations. They've recommended that we should replace how we bargain over pay. What the hell that's got to do with COVID is, but you can see there is very clearly a political agenda at work. Sorry, that was longer than you probably wanted. But,
no, that was very comprehensive, very interesting. I want to get clarification on something that from reading, and as you've said disregard most of what I've read in the media. Something I was confused about. So in terms of getting the test between, working in a COVID-facing service and the fire service, it's not sort of like someone from, a firefighter gets asked, can you move some bodies today? And then they self-isolate for 3 days. Is it that people are doing, a couple of weeks shift doing a COVID-facing thing, and then before they go back to sort of the fire-facing stuff, they need to have a gap in between those two roles?
That's precisely it. We because we identified these were higher risk activities, we said the best model would be to detach them so that they go and work completely. So some of them are working in the local ambulance service or a hospital or whatever, or a specialist team. So that the body movement teams are just fire service teams, but they're put into another venue and they're kept there to protect the other workplace, because we don't want the virus spreading into the workplace. And we've seen in a couple of instances where suddenly dozens of fire stations go off the run because everyone is either testing positive or self-isolating as a result of that. So it's a perfectly sensible measure. So you're exactly right. It was they were detached for several weeks at a time, and before they returned to their normal duties, they were required to undertake the test.
Yeah, so this is talking about 3 days off work not off work, as you say, they could be working from home, but 3 days out of active service in between 5 weeks of working in one job and 5 weeks in working in another, not these constant days off.
By the way, that would be on that would be their rota days, so it wouldn't affect their work pattern at all.
My final question for you, and it's almost, I suppose it's partly philosophical, partly practical. So in what I've read, the argument that's being made against the FBU is they're saying, look, the demands the FBU are making are higher than the demands that police officers are making, paramedics are making, and other frontline workers. I suppose the demand for a PCR test before they go back to their normal workplace. Is your argument that this is just a flawed argument because it's saying we need to level down to the conditions that, there's no reason why firefighters should be as unsafe as police officers? Or is the argument that you're in a fundamentally different situation to police officers. Which one of those is it, or a bit of both, I suppose?
The key point is the one that you identified correctly earlier. It's the moving between the one workplace and the other. Interestingly, we also had ambulance services who were requiring firefighters to test before they joined their teams, precisely for the same reason, to ensure that there wasn't somebody bringing COVID into their workplace and potentially taking loads of ambulances off the run. So a perfectly sensible policy from their point of view, and a perfectly sensible policy that operated for 8 months or so without, and it's still in place in many fire services, by the way, that policy. Many of them have not challenged it. It's driven by certain individuals and, in our view, a political agenda behind that.
Which is why you're saying it's not you telling people not to volunteer, it's you saying, no, you should still maintain this condition that we test people in between going from one workplace to another.
Keen to return to the negotiating table and resolve that.
Matt, Wrack, thank you so much for joining us this evening and explaining the dispute. As I agree with you, actually, that the media reporting of this has been, when I read the BBC report, it wasn't just I was like, this seems biased. I was confused. I couldn't really work out what was going on. So thank you so much for clearing that.
Thanks for allowing us to set the record straight then. Great.
Cheers. Let's go to a couple of comments, or no, I'll save those for in a moment. We have 2,000 people watching. If you're new to the show, please do press that subscribe button. We go live every Monday, Wednesday and Friday at 7 p.m. And if you hit the notification button, you'll find out when we do impromptu shows, because something has happened that's such a big deal. Let's go to our next story. Now, no one at the top of government has showered themselves in glory during this pandemic. Boris Johnson dithered and delayed over lockdowns. Rishi Sunak pushed to reopen the economy before it was safe. And Matt Hancock doled out £22 billion for a test and trace system that doesn't trace. But the government minister with the most shameful record during this pandemic, and who doesn't appear to have had a single achievement to his name, is Education Secretary Gavin Williamson. So given all this, it's not a surprise that while most politicians tend to come off badly when they go up against Piers Morgan, we've shown you two screamers this week, in fact, one with Priti Patel and one with Matt Hancock, Gavin Williamson comes off even worse.
You assured us in late December that the schools would definitely be reopening. Everyone got wildly excited and everyone went back to school for one day, and then they had to shut, which was one of many, many U-turns that you've had to make in this pandemic. I mean, if you go over your charge sheet, your record as leading our education system, repeatedly shamed over school meals by a footballer, exam result fiasco, the school reopening catastrophe, where you basically sent millions of kids back to school for one day to all infect each other and then go back to their homes so they could infect their elderly relatives, which may now be why we have this horrifying daily death number. We had a poll at ITV 2 weeks ago. We asked England's teachers whether you should resign. 92% of them said you should go. And it does beg the question, given this series of abject failures that you've presided over in the last 10 months, why are you still Education Secretary? Why haven't you done the right thing and resigned and let somebody more competent take over and do a proper job? Because you have failed our kids.
So, Piers, we're facing more disruption to our education system than we've ever seen, even during the Second World War. We are faced with a new variant of a virus that at the start of December wasn't known about, and even in mid-December...
We knew about the new variant on the 19th of December because the Prime Minister told us it was 70% more transmissible. And yet you said a week later the schools were going to reopen, even though many experts were saying, don't be ridiculous, that is a crazy thing to do. You then insisted on reopening them for one day and said there was not going to be a U-turn, and literally after one day you shut them down. It is hard to conjure up a more incompetent decision-making process than that.
Well, the advice that we're receiving as to whether we could continue to have primary schools open, we'd already delayed the opening of secondary schools in light of the new variants. But then when the country moved into a COVID alert level 5 and more of the data was coming through, it was a national decision that was taken in the national interest to close schools.
Now, I'm not going to repeat all of those failings because Piers Morgan did a very good job of it. I'm just going to, very briefly analyze what Gavin Williamson said there, because his final answer there was very interesting. Did you notice there was a sentence which he started but he didn't finish? He said, in response to this argument about why they didn't know, why they didn't sort of realize it was inevitable that schools would have to close on 4th of January until the 4th of January. And he said, well, the advice we were receiving was about primary schools. He didn't finish the sentence. And I think the reason he didn't finish the sentence is because the advice from the 22nd of December was that all schools are going to have to close if you've got any hope in hell of getting the R number below 1. He then sort of said, he talks about this alert level 5, and this is quite interesting actually. So this is, do you remember, it looked a bit like the sort of Nando's spicy gradient, and we can go from red to green, alert level 1, 2, 3, 4, blah, blah, blah. And this was initially seen to be a bit of a sort of PR stunt. It seemed like a PR exercise for the government. It turns out actually it was quite useful for Chris Whitty and the other chief medical officers to force something on Boris Johnson when he was so resistant to it, but that there was no other way of making it happen. So when it came to schools, what was going on, inside government was you had Chris Whitty and the chief scientists, the chief scientific advisor, sort of saying, look, you've got to change course. This doesn't make any sense whatsoever. Boris Johnson's got Sunak in his ear saying, no, we have to keep the economy going. Gavin Williamson's in his ear just saying, like, I want to keep schools open because I haven't managed to buy anyone laptops yet. And so he's like, well, we'll keep them open until there's this big intervention from the chief medical officer who's like, we're going into, alert level 5. And then he basically took the choice out of Boris Johnson's hand. So that idea they didn't have the advice beforehand, it's just not true. That was, I suppose, the well-researched critique of Williamson's time in office. But next, he really went in for the kill.
Have you offered your resignation to the Prime Minister at any stage of this pandemic? Yes or no?
My focus, is making sure that children get the best remote education while they're not in school.
You're the Education Secretary. I expect it to be. But have you offered your resignation?
Our focus is making sure that children return to school at the earliest possible moment. And Piers, the other thing that we're doing...
Is there a problem on the line? Can you not hear me?
Mr.
Williamson, you seem to be totally ignoring me. I'm just asking you a straight question. Given the level of failure in your reign as Education Secretary in this pandemic, given that 92% of teachers in England want you to go, given that you're being described by the Labour Party and the Liberal Democrats as the worst Education Secretary in British history, I simply ask you, have you looked in the mirror and thought, you know what, I've done a terrible job, I'm going to say to the Prime Minister, it's time for me to step aside and let somebody more competent take over? Have you had that conversation with yourself, and have you then had it with the Prime Minister?
Piers, my one focus is making sure we deliver
we know what your focus is. You're the Education Secretary. The problem is your focus has not proven to be very good, has it?
We're dealing with a global pandemic where we've had to make decisions at incredible pace, decisions that none of us would have wanted to have taken.
You've made a series of bad decisions, Education Secretary, decisions that have had huge ramifications for teachers, for students, for parents. You've been a catastrophe. Own it.
So our focus is always about bringing children back into the classroom.
Now, the subject matter is not funny. The subject matter is tragic. What Gavin Williamson has done over the past 9 months is put teachers at risk and basically gaslit them. They've said teachers are at no more risk than the rest of the population. Not true. He's forced kids to go into school one day so that they can all, share coronavirus around them, only to have a lockdown by that afternoon. And I think that, the thing that strikes me more about Gavin Williamson, that I think is so sort of unique about his role as a Secretary of State, is not the mistakes he's made, but that he hasn't done anything positive. So there was a Times report about the run up to this final lockdown, where apparently in one of those COVID sessions that the people at the top of government have, someone said about closing schools, but they don't have laptops yet for the kids without them. And Matt Hancock was like, what's Gavin Williamson been doing for the last 9 months? Because Matt Hancock's made a lot of mistakes, but also the Department of Health has at least done some stuff. I'm going to go to Dalia in one moment. First of all, unfortunately, we never get secretaries of state on this show because I would absolutely love to grill them. But we do give the best analysis of the bullshit they talk about. So make sure you subscribe to the Novara Media channel. You can watch this show live every Monday, Wednesday, and Friday at 7 p.m. And if you subscribe, you can see all the videos we put out as well. Dalia, I want to bring you in on this. And in fact, there's a super chat from Dan TFT with a $5. Michael and Dalia, can you name a worse candidate for Education Secretary? It's surprisingly difficult.
I mean, that interview was absolutely like one of the most tragic things I've ever seen in my life. I think it was the idea of Piers Morgan like calling on Gavin Williamson to like look at himself in the mirror and be like, I'm a piece of shit. Like it just was so like, oh my God, how are we here? But, you know, this is a government that just fails upwards. You know, they figured out that, you know, and this kind of moment with Piers Morgan is a bit of an exception to that, but they figured out that in general, the media treats them with such kid gloves and has such little will to hold them accountable. So many of these, you know, editors and journalists are their mates. You know, that if you just kind of hold your nerve through each failure, it won't be long until the media just kind of back off and it becomes old news. And even it's sometimes even worse than that, which is, you know, I just was thinking about when Rishi Sunak was creating a policy that literally caused another wave of coronavirus. And he got portrayed as a literal superhero by the BBC, you know, and compare that treatment by the media to the treatment of, you know, the institutions that are actually keeping not only workers but the broader community safe, and those are unions like the NEU, like the FBU, like, you know, the Fire Brigades Union, who are actually putting in the fight necessary to protect. Can you imagine if kids had been in school right now? Like, can you imagine what the infection rates would be right now? And yet for those institutions that are actually doing the work to keep us protected, they are relentlessly demonized, sidelined, and sometimes outright lied about, as, you know, Matt Wrack outlined just earlier in the show. You know, but the absolute kind of failure that Gavin Williamson right now is not just going to be understood in the context of this pandemic. The effects are going to be incredibly long term because of how long children have been kept out of school for, and how unprepared you know the system is to do some kind of distance or hybrid learning. You know, firstly, like the broad failure of the government to keep infections down and to use the time that we've had wisely has basically meant that we've had to keep schools closed. We've had no option other than to keep schools completely closed for longer periods of time than would have otherwise been necessary. You know, and that's going to have like long-term effects on a lot of these kids, particularly from working class backgrounds. But secondly, there's just been a complete lack of leadership when it comes to devising innovative and creative ways to deal with this new normal, to prepare for, you know, equitable distance learning, whether that means, you know, using the time that we had, for example, in the summer, when infection rates were low, using that time to experiment with different kinds of models of education that could work in distance learning, making sure that every kid had the means to do distance learning in an adequate way. Because, you know, as someone who's done teaching in a hybrid setting, the main issue is that a lot of, you know, it's very, very difficult to keep kids and keep students engaged. But there are ways through, you know, because of uneven technological access, some students having like really bad internet connection, students not having like the space and the ability to kind of do what they need to do. So, or you could have had, you know, a system whereby in the summer when infection rates were really low, having, you know, maybe more of the teaching term that's being conducted now done back then. There was just no, and I'm not saying that any of that could necessarily work. I haven't, you know, you need to kind of look into that. But there's just been such little innovation, such little creativity when it comes to dealing with a situation that we knew was a long time coming. We knew the winter was going to be hard. We knew for a long time as well that schools were super spreader sites. But instead, Gavin Williamson focuses on wasting that really precious time of doggedly pursuing a failed strategy until the very last minute, instead of using that precious time to pursue something else or to innovate and create different ways of doing things around these conditions that are going to be with us for a while. And then changing at the last minute, therefore not giving teachers enough time to prepare. So now we have the worst of both worlds, which is that students are doing remote learning, but they're doing it in ways that teachers and schools have not been able to prepare for to make it a viable way of teaching. And this really does come down to a kind of total disrespect and lack of engagement with teachers and workers more generally that we have seen from this government. And those workers and teachers are the best placed to actually devise something that is feasible and to actually declare what is and is not possible and what is and is not in the best interests of children's learning. And we saw that in the abhorrent treatment of the education unions by the government and the media, and had more time actually been spent collaborating with the unions, collaborating with teachers to think, okay, how are we going to make the best of a bad situation in order to minimize the outcomes of this disrupted learning for children, then maybe we would have actually been in a much better situation here. But that is the scandal. And I guess the thing is, why should Williamson resign when this kind of approach of doggedly pursuing bad strategies until the last minute and not giving people enough time to prepare for the thing that we knew was going to be inevitable? That's kind of the substance of the government's approach across the board.
I mean, that's an interesting point in terms of, because normally what's sort of the convention in Westminster is that if your government's had a massive screw up, then you throw someone under the bus. So even if it is the Prime Minister's decision, and I think in terms of schools opening for one day on the 4th of January before they locked down, that was the Prime Minister's decision ultimately. But what you would do is you say, look, someone has to face the consequences for this. It's going to be Gavin Williamson. Boris Johnson stays in his place. Boris Johnson has a slightly different strategy, which is to say, if I surround myself with people who are even more incompetent than me, then they can take the flak permanently. And people will assume that, oh, well, if Gavin Williamson is not going to go for those failures, if Rishi Sunak is not going to go for Eat Out to help out, then Boris Johnson isn't going to go. He's definitely not going to go. So it sort of lowers everyone's expectations about what a politician should be like, the capacities they should have, which relates to a comment on Twitch chat from Scar DB. They're so used to not being accountable at all that they think this behavior is fine. Absolutely. We have 2,000 people watching. Do like the show if you're enjoying it. I hope you are. If you've watched this far, it does mean that our videos are more likely to appear in your home feed, so you can crowd out whatever other channels you're following. I mean, maybe some of the channels you're following are our friends and allies. So let's go on to our finals. It's getting late, isn't it? It's getting late on a Friday. Last December, when doing his monthly slot on Nick Ferrari's LBC show, Keir Starmer was confronted with a racist conspiracy theory. The context was a conversation about Millwall fans booing when players took the knee in support of the Black Lives Matter movement. A woman introduced as Gemma from Cambridge called in to explain her husband had been one of the booing fans. She had this to say.
Gemma, why did your husband, sorry, you didn't quite explain, if I may go there again, why did he choose to boo, sorry?
Because if anything, the racial inequality is now against the indigenous people of Britain, because we are set to become a minority by 2066. And taking the knee, bringing the political sphere into the football arena, and we just have to look across to the Middle East. Israel has a state law that they are the only people in that country to have self-determination. Well, why can't I, as a white British female, have that same right?
Final point to you on this, Sir Keir.
But Gemma, we all have those rights. This is about recognising some injustice has gone on for a very, very long time. And I think people were genuinely moved this year and want to make sure that injustice is dealt with. And, people will look at it different ways. But I think the vast majority of people do want a more equal society.
Gemma, thank you. To other calls, Dominique and Islington.
Now, in that very short clip, you heard both a far-right conspiracy theory and a far-right policy proposal. So the far-right conspiracy theory was the Great Replacement. So what it says is that Indigenous people, well, I'm not going to say that without quote marks, Indigenous people, which is her terms, by which she means white people, are being oppressed because they are being, the demographics mean they're going to get replaced by ethnic minorities or non-Indigenous people, in her words, by, I think they say 2066. It sort of grows into this conspiracy theory where you have shadowy elites, often coded as Jews or often explicitly said to be Jews, who are intentionally trying to replace white Britain. So she went on LBC to say that it's white people who are subject to racism because of essentially the Great Replacement theory. The far-right proposal, so this is the solution she was suggesting, is that Britain should adopt something like Israel's nation-state law. So that law states that only Jews in Israel have full democratic rights to self-determination. So I presume that person who was introduced as Gemma from Cambridge presumably wants white people to also only have full democratic rights in this country. Both appalling far-right conspiracy theories and policy proposals. We talked about them on the show. And last time we talked about this clip, because that happened in December, we focused on Keir Starmer's weak response. So in response to that claim about the nation-state law, he said, we all have those rights, and we don't all have the rights to sort of self-determine on the basis of our ethnicity. No, we don't, because we live in a multicultural society, as we should. Also, when we talked about that show, and what we also focused on was the identity of that person who called in, because Gemma from Cambridge wasn't actually Gemma from Cambridge. Gemma from Cambridge was actually Jodie Swinger, Jodie Swinger, a yoga teacher. Swingler, apologies, was Jodie Swingler, a yoga teacher in Ibiza who is a member of the relatively new fascist party Patriotic Alternative. Now, on far-right blogs, after that conversation, there were people sort of celebrating, we've got our far-right talking points onto the mainstream media, and not just that, we've put them to the leader of the opposition. It was already a pretty nasty story, but it gets worse, because we had assumed that what had happened there was this person from a far-right party had sort of basically trolled LBC. We assumed that she'd called up and said, I want to ask Keir Starmer a question about Black Lives Matter. And then, unbeknownst to the producers, that's when she introduced the Great Replacement theory and this idea about the nation-state law. But it turns out that, in fact, Jodie Swingler, although they didn't know she was Jodie Swingler, she was invited by producers onto the show. So this is from this week's Private Eye. Now, after her turn on LBC, Swingler took to the airwaves on an episode of The Actual State of Britain, a racist anti-Semitic podcast run by PA supporters. In the podcast, heard by Red Flare and Private Eye, she reveals that LBC actually encouraged her to call in. She says that a week previously, she had made a call to presenter Maajid Nawaz's show on LBC, claiming that her Millwall supporting husband had booed taking the knee. So she'd sort of done this already to Maajid Nawaz, phoning up, pretending to be Gemma from Cambridge and saying my husband was one of those people booing. Then, so after doing that, they phoned me up. So this is her speaking now on the podcast. They phoned me Sunday night and said, Keir Starmer's on. Would you like to speak to him? I was like, yes, I would. But they said, with this, ask a question about the Millwall taking the knee. Does he agree with freedom of speech? And they knew, because of my previous call, they must have known I would have brought Israel into the conversation, and seeing how the left has blown up. I honestly think they got me in as a bit of a trap for him. Now, that is appalling. And as I say, I doubt the LBC producers knew that she was actually this yoga teacher who was in a fascist party. But what they did know is that she'd spoken to a previous host on their radio show, and as she said, talked about the nation-state law then. So all of the red flags, they had all of the red flags that this was not just a normal person discussing freedom of speech and issues of whatever. This was someone who was an organized fascist who believed in fascist conspiracy theories. And what they've done, this was explained to me by Fox, our producer, who used to work for LBC before we poached him. He comes to a show now where we don't seek out far-right callers to speak to the politicians we have on, is that before the sort of big headline phone-in shows with big politicians like Keir Starmer or Matt Hancock, they don't just let any old person call in what they do is they seek out the best questions. So they'll be listening in on previous shows throughout the week, and they'll say, oh, that caller, I'm going to get them back for this politician. And what LBC did was they heard that caller, this far-right caller, do all of these far-right talking points, and then they said, oh, let's get them on with the leader of the opposition. I'm going to go to Dalia in one moment for what she thinks about this. First of all, if you want to subscribe to a media platform that doesn't intentionally invite far-right people on to amplify their ideas to the nation, then subscribe to Novara Media. We go live every Monday, Wednesday, and Friday at 7 p.m. Dalia, what do you make of this? The LBC, it wasn't them getting caught out. It was them actively seeking, it seems, to platform these far-right talking points.
Yeah, we really underestimate how right-wing the British media is, and I think that this is especially the case for newspaper but also radio media. And this is a harsh lesson I've had to learn from doing more media, from going on radio shows that I haven't otherwise listened to before, of doing newspaper reviews and things like that, and being kind of like regularly involved in that. And these outlets like LBC, like Talk Radio, these are deeply right-wing radicalizing outlets, but they are sort of allowed to be passed off as kind of just neutral actors in our kind of media sphere. And, I remember on LBC not that long ago when I was invited to talk about I think it was a report that was being done by the University of Cambridge on looking back at, how the historic relationship between the University of Cambridge and slavery. And, they sought out a random guy with a history degree. All his only qualification for being on there was, I've edited a book and written several articles and essays, including academic essays on this topic. And they sought out, some random dude who had done history at Cambridge, who came on and started talking about how Africa has never had a civilization. So, we shouldn't be, it's somehow, okay that slavery happened. I don't even know what that was, but that's an example of this kind of, from production, that background production, who decide who go on, etc., to those kind of front stage people who are on the front of the stage, like your kind of Nick Ferraris, etc. But the UK media is particularly rabid when it comes to issues of racism and immigration. The UN High Commissioner of Human Rights has had to sort of regularly call out the UK media as being specifically awful when it comes to this topic. In 2015, the UN called out the, quote, decades of sustained and unrestrained anti-foreigner abuse, misinformation, and distortion. It wasn't that long ago that Katie Hopkins had totally free reign in, a major newspaper and an LBC, a major radio station, to literally refer to migrants as like cockroaches because they are built to survive a nuclear bomb. That's almost identical to the language that was used in Nazi propaganda, and that's exactly what the UN High Commissioner said. And, so in all honesty, when I see these kinds of things, it honestly makes me laugh at the kind of big crocodile tears that we regularly see in the pages of newspapers and in, radio shows about, how PC culture has gone mad and how, their free speech is undermined because of how hard it is to be publicly racist. And also there's an issue of endemic transphobia as well, which is kind of similar. When the exact opposite is true. The status quo of the UK media is to systematically allow for the platforming of this kind of racial terror, of conspiracy theories that led to the murder of one of our MPs. And it's just that for the first time ever, some of them are experiencing minor amounts of blowback for this on social media for their comments. And that's hurting their feelings because they're not used to hearing the other side of this kind of systematic, inclusion of sort of very, very right-wing concepts and very right-wing ideas and platforming and encouraging them. And we see a much higher representation of that than we do of, the anti-racist position. So I think, it's shocking. But as someone who has, and I'm sure you feel the same, Michael, as well, as someone who has been more involved in the kind of, talking to producers and having more awareness and being in green rooms and having a bit more awareness about how this whole thing works, it is of absolutely no surprise to me that this is being systematically pushed from kind of the people who have the power to produce the content that is then passed off as sort of falling from the sky out of context.
Absolutely. We're going to go to some comments. And actually, the first comment I'm going to go to you is really putting you on the spot, Dalia. It's a positive message, but it's also, So it's from Louis Gardner, BRFC, with a tenner. Thank you very much. Hey, at my uni, which is Liverpool, we are using one of Dalia's papers when discussing decolonizing the curriculum. That's the nice bit. This is the hard bit. What do you know about the risks of asylum seekers detained in Napier Barracks? Now, Napier Barracks is the former Kent Army Barracks. Or do you know this? Do you need some background, or you want to go on this?
Yeah, but if you want to give some for the audience.
Okay, so it's a former Kent Army Barracks being used to house asylum seekers. It's been locked down, preventing its 400 residents from leaving after scores of people tested positive for coronavirus. This is Guardian copy I'm reading now. So the private contractors who manage the site at Napier Barracks near Folkestone on behalf of the Home Office have advised its residents the entire camp has been placed into isolation, with police officers enforcing the move. So yeah, that's the background. I'm just learning about this. But Dalia, what do you make of this? What's your response to that question?
Yeah, I mean, this is kind of what we're seeing across not just in detention centers, but in prisons as well, which is kind of this, you would expect it to happen basically in the kinds of conditions that we see in the prison system and in the detention system in this country, that an outbreak of this kind would be very likely. Even in the best of times, there is not much money or not much time invested in making these. I mean, I don't think they should exist to begin with, but in making these, safe places. So I can imagine that in the middle of a pandemic, that's not going to really change. So I think the question here is, how did we get to this position where clearly identifiable risks were not mitigated? And that is, partly to do with the very essence of what a detention center is, but also it's to do with the fact that a lot of them are privately, are contracted out. And as we've seen in this pandemic in general, when you contract out, essential services like this, not that a detention center is an essential service, but the last thing on their kind of priority list is actually the welfare of the people that are involved and implicated on the other side of what they're doing. So it's obviously of absolutely no surprise to me that detention centers have become even more unsafe than they already have been.
I mean, really awful. Obviously, it's it's a population that the government are very happy to ignore because they don't have many people standing up for them in the mainstream press or politics. Well, thank you. I think it's just disappeared. I think it was Louis Gardner. Thank you for bringing that Louis Gardner to my attention and our audience attention. Obviously, it was already in Dalia's frame of reference. A couple of more comments. Matthew with a £10.30 super chat. Hi, Michael. Could you please do a birthday shout out for Cornelia, who is 30 today? Happy birthday, Cornelia. She is studying immunology, loves your show, and thinks your coverage of the pandemic is the best in the UK media. Thanks. Oh, thank you so much. I do really appreciate it when people who work in the sciences appreciate what we're doing on this show, because obviously, when it comes to epidemiology, immunology, these kind of things, I'm learning on the job. I know politics. So I do appreciate when people who are, who work in that line of work appreciate what we do. Thank you very much, and happy birthday. And we have a message from a viewer, which is an email to Novara. Oh, I love it when we get these. Thanks for acknowledging my donation. So this must have been on a previous show. The little bit of me that craves fame would like to do super chats, etc. But as a 70-year-old geezer and unrepentant technophobe, I never make it that far. Important to say, though, that I value Novara so much. The work that you do is wonderful and heroic and inspiring. In all these dark times, you help to keep powerful beacons burning. Long may you continue in gratitude and solidarity, Bill Payne. Thank you so much, Bill. That is such a sweet, lovely message. All of our gratitude and solidarity straight back to you.
Absolutely.
We're going to end the show there. Dalia, any big plans for the weekend? There's not many answers you can give that wouldn't get you into lots of trouble.
No, I have a massive work deadline at the end of this month, so I'm just in that depressing hole, and I can't even get like relief from it through seeing my mates. So I will just be trying to get to the other side of that deadline. But yeah, so nothing really that big. Probably going to eat myself into a hole because it's the only thing we can do right now is just eat delicious food.
The last time I looked on my weather app, it's going to snow in London on Sunday, which, you know, adds a little bit of variety to all of our lives. Thank you so much for watching this evening's show. It's been a pleasure spending this Friday evening with you. If you want to support the work we do, please go to support.novaramedia.com, or actually we've changed it, novaramedia.com/support. I think both addresses take you to the same place. You know, our ask is the equivalent of 1 hour's wage a month. If you're already a subscriber, thank you so much. You make this show possible. If not, what are you waiting for? For now, you've been watching Tysky Sour on Novara Media. Good night.